Welcome to the Mug Hub podcast, the ultimate platform for all things related to medicine's use, patient care, and the incredible world of pharmacy. We are your hosts, Connor and Sian, and we're thrilled to have you join us today.
Here at the Mug Hub podcast, we're passionate about empowering future pharmacists, expanding your knowledge and igniting your curiosity. Whether you're a first year embarking on your pharmacy journey or a final year getting ready to go out into practice, this podcast is designed just for you.
Across our series, we delve into 4 captivating themes that will take you on an enlightening and entertaining journey. From exploring intriguing clinical topics to showcasing the extraordinary individuals who make up our incredible teams, we're here to unlock the secrets of the pharmacy world.
So grab your favourite mug, settle in, and let's embark on an incredible voyage together. Get ready to be inspired, educated, and motivated as we unlock the vast potential of pharmacy and the vital role it plays in healthcare. Welcome back to another episode of The Mug Hub. Today, we're fortunate to have a very special guest. We have the Chief Pharmaceutical Officer for England, David Webb.
And we're changing the format up a little bit, so we've got 3 of our student pharmacists taking over the podcast. So after this, we're leaving the studio and letting our student pharmacists loose.
Where should we go, Connor?
Let's go have a coffee and we'll
Okay.
see them back in 40 minutes.
Sounds good.
Hi, my name's Abeer. I'm a 4th year student pharmacist, and I'm also the student engagement rep for the School of Applied Sciences.
Hi, I'm Liv. I'm 4th year student pharmacist as well, and I'm also co-president of the University of Brighton Pharmacy Society.
Hi, I'm Patrick Stone. I'm a first year student pharmacist here at the University of Brighton.
Hi.
How are you?
Good.
Good.
Nice to meet you.
So, oh, drop my bag off, is that?
Yeah,
Yeah,
sure,
that's
it's fine.
This is very cool. I've never done this before. How
No,
exciting. So, I'm David, by the way.
Good to meet you
Nice
as
to
well.
meet you.
Yeah, lovely to meet you all.
Okay, cool. So could you please explain a little bit about your role and how you got here? What does a working day look like for you?
Well, thank you. How did I get here? That's the question I'm asking myself right now. Well, let me start with the role, maybe. So the role really has sort of 3 main functions. The important things are about providing senior advice and guidance to decision makers and policy makers, and that's across the health system. So some of it's NHS England, some of it's supporting the Department of Health and Social Care as well. And it relates to 3 areas of activity. So one is pharmacy services as a whole. Second one is pharmaceutical services delivered through community pharmacy. And the third one is about medicines optimization and the way we should be helping people to use medicines more appropriately. And those are the 3 sort of big chunks of activity. The other thing I'd like to mention as well is the job also is about being the head of profession for pharmacists and pharmacy technicians in England, and that's about 70,000 souls. So there's a really important thing about helping to shape the future for those people and making changes that they would want to see. But it all boils down to benefit for patients, really, and that's the fundamental focus of what we're doing. And I think you asked about what does a day look like.
Yeah.
So it's a real stretch in the sense of it covers things from really important policy decisions about where we're going with pharmacy services, for example, through to some really specific stuff, almost about individual patients. And that span makes it really interesting. The actual day itself is composed of a lot of meetings, because the main thing about what I do, I think, is to be sort of available to people and stay in touch with people and understand what's going on. So I think if you looked at my calendar, there'd be some visits like today, but a lot of it would be sort of meetings with people, and whether they're stakeholders or pharmacy professionals or sometimes even patient group representatives as well.
Sounds amazing.
Has its moments, you know.
So my question is, what are some of your most memorable experiences in your pharmacy career? So, for example, what are some times where you felt like you really made a difference to a patient
Okay.
or patients?
Thank you. So there's I think there are things that happen to you in your career that are they're quite sort of pivotal in terms of the experience you had. And the thing that always sticks out to me are the patient encounters and the way those shape your practice, maybe even change your practice. And there are patients that I remember throughout my career, some specific examples of patients with cancer, patients with endocrine disabilities, and was always struck by how their sort of hopes and aspirations really kind of motivate you to do the best to be the best pharmacist you can be for those people at that time. In terms of really concrete experiences, I was very fortunate at the start of what we recognised ultimately as HIV. We had a small group of us who were called the AIDS pharmacist group, because at that time we didn't actually know the causative agent. We just knew the syndrome of illness that people presented with, and we were using everything pharmaceutically that we could to support people with that syndrome at the time. And I just remember it being a really it was kind of positive because we were using pharmacy skills to do the best that we could, but it was also that patient cohort kind of drove us to do better for them almost. There was this sort of venturing together sense. And then, of course, HIV was revealed as the causative agent, and then we moved into an era of antiviral medication, which again was this sort of huge change in practice. So that really struck with me. And the last thing I thought about was I was the chief pharmacist at Guy's and St Thomas's during the pandemic, and the way the whole pharmacy team sort of responded to that was just the most amazing experience, because you could see the talents of lots of different people coming together to, more latterly deliver the vaccination centre, then the COVID medicines delivery unit, and the use of antivirals for people with COVID-19. But before that, the way the production unit made things that we couldn't get, and the way the aseptic unit put intravenous doses together to take the pressure off the critical care setting, the way the procurement and distribution teams worked, the way we got guidance out where there wasn't guidance, and the way the whole sort of clinical team put their arms around critical care and swelled the number of people going to critical care, but also supported other patients throughout the hospital. It was a real privilege to be part of that amazing team, and that's kind of stuck with me for just what pharmacy can do when it puts its mind to it, really.
Wow, that's incredible.
Yeah, that's really cool. So for the next question, we think some of the students listening to this would be interested in developing, as they graduate, developing into clinical leaders, such as yourself. Could you please talk a bit about the clinical fellow scheme and the impact it has made, and how the students can get involved later on in their careers?
Okay, so the clinical fellow scheme is, I'm biased, but in my view, it's this brilliant experience. I, tend to use the word immersive because we take people apply, and applications are open now, obviously, for the next cohort. People apply, they go through quite a rigorous selection process, and then they get put into one of a number of leading health or health-related institutions, but they're all under this sort of umbrella of the Chief Pharmaceutical Officer's Clinical Fellowship, which is run by the Faculty of Medical Leadership and Management. So not only are they having this sort of fairly unique pharmacy experience, but they're in amongst a cohort of people who are medics or dentists or sustainability fellows, and they're sort of getting that multi-professional exposure as well as the opportunity that comes through just being seated quite close to decision makers in all of those organisations, and that I think is the bit that really shapes people. The other thing that happens is normally in the team there's quite a strong orientation to being active and being an activist. So people really seize the opportunity. So I know one of the cohorts managed to sort of persuade Amanda Pritchard, who's the chief executive of the NHS, that she would like to spend some time with them, which was an amazing thing to pull off. but also to have the confidence to ask. I think other people have met politicians, secretaries of state, and those sort of things, and that's because of having the freedom to do that and almost the excitement to do that. So I think it's a really positive thing to do, and I'm just delighted to be able to sponsor it really and encourage people to take part.
Incredible. Talking about opportunities, as of next year, students are going to be graduating as prescriber ready. So what are your views on this, and how do you see it in practice?
Well, my views on this are it's a fantastic opportunity. It's a game changer for pharmacy.
Yeah.
This is the new era of pharmacy practice, and you'll be part of that, of course, won't you? That new wave. I think how do I see it developing over time? Almost is I think people will emerge with a skill set that will enable them to respond to sort of immediate patient need. So it'll have a breadth, but it's probably more focused towards sort of acute or episodic care. And then as you develop over time, because nobody's the same practitioner they were 10 years ago, so you might come out with a sort of well-defined prescribing skill set, but over time you're going to develop that skill set. You might decide to specialize. You might decide to go into something more deeply. You might want to get into collaborative care for people with long-term conditions. So I suppose what I'm saying is that the prescribing practice you start with is not necessarily your end point. It's a beginning, and as you work in sort of multi-professional teams and learn from other people, then those skills will develop, become more honed, hopefully set you on a path that's going to make you want to do different things. And we see that in hospital pharmacy practice, where maybe there's been a bit more experience around prescribing. So some of those pharmacists are prescribing chemotherapy, they're working in outpatient settings, prescribing medicines for long-term conditions. So that the path is there. It's just having exposure and developing yourself after that start point, I think, that's important.
So my next question are there any specific areas or priority issues that you are particularly concerned about, and how does your team go about tackling that?
So the one thing about my work is that I benefit from a great team at national level, but there's also a team at regional level who help us shape all of those things. And then we work very closely with the chief pharmacists of the ICBs, or the systems as we call them, the 42 in England. So that whole kind of network we're able to bring to bear on problems as we see them. And it kind of goes in phases. So I tend to see more about priorities than problems per se. But I think there are some really important things for us to tackle. So I think health inequalities are a really big issue for us. And there's something I think very unique about potentially community pharmacy and its diversity and its reach and its representation of local communities that enables us to do something quite profound. So we run something called the Inclusive Pharmacy Practice Programme. That's a bit about holding a mirror up to ourselves and saying, well, how representative are we as leaders of the diversity we see in the professions? But there's also a sort of second lens, which is looking at populations and saying, are we leaving people behind? What's the inclusive healthcare approach to these people? Is there a imbalance in access to digital technology, for example, or are people being challenged around whether they can read and understand the way we explain medicines to them? At the moment, we're thinking very much about mental health issues and the sort of inequality that brings. But in the past, we've looked at cardiovascular disease and how pharmacy in particular can reach out and maybe tap into communities that wouldn't normally access healthcare in a kind of more predictable fashion. And that's a huge excitement. So that's one priority, if you like. The other one I think that's really important at the moment in hospital pharmacy is we've moved from a kind of era of automation and focus on solid dosage forms into one where the new medicines, the innovative medicines, require if you like, more sort of practical skills around handling of medicines, aseptic preparation, those sort of particular skills you need, and in environments that have to be of a certain standard to do the work. And so there's an infusions and special medicines program that's run by my colleague Sue Lads, which is absolutely focusing on that. And we've got this real ambition to prepare more medicines in a ready-to-use form so that nursing time is saved because it's presented to them as something that they can give straight away without having to make it up themselves in sort of environments that are probably less suitable, but also that it takes so much time. So that's a really important focus for us on the hospital pharmacy side. And then my third priority at the moment is landing independent prescribing as practice for the future, but in a consistent way so that it's available to members of the public. So we've got some great stuff happening around pharmacy first, but you may know that's the mechanisms that underpin that are based on something called a patient group direction, which is a sort of way of authorising the supply of medicines. But, the next transition will be for that activity not to require PGD, but to be run by independent prescribers. So, that's a really important area of focus, I think, for us at the moment.
I was just going to ask, in terms of this sort of new generation of independent prescribers, do you think it's sort of going to look towards specialising maybe in a particular area, or sort of just the broad range of prescribing that could be done?
I don't think it's either or. I think it's probably both, because in certain circumstances, so for example, community pharmacy, your ability to respond to people who present with an acute problem, but across a broad range of syndromes or symptoms, that's going to be very important. In other settings where you may choose to specialise, having that in-depth knowledge and ability to, for example, look after patients with rheumatoid conditions where you're using sort of disease-modifying agents, which takes a certain amount of skill and understanding to do. That, I think, is a progression depending on the circumstance you find yourself in. So I think it can be both. I think you can move up as a generalist because that's really valuable. But I think also people may choose to specialise because it suits the environment they're working in at the moment.
Oh, thank you. So sort of going back to what we were saying about inclusivity, the NHS Learning Support Fund has helped to promote diversity in the workforce of many other healthcare professions, but this isn't currently available to pharmacy students. Do you know why, and do you think this will change anytime soon?
So that's a really important point, and I think we'd all want to see people supported so that their kind of financial situation didn't preclude them from participating and gaining fully from educational programs. So that's a really important point of principle. The reason it is as it is at the moment is historical.
Okay.
As in, pharmacy was never part of that arrangement. So that's kind of where we are. I think it's important so we're really minded to try and make a change to that situation. The thing is that's a kind of governmental process, and so I suppose although we are putting our minds to it, it is going to take some time to change. So I think that there's an element of patience about this as well, because just changing the way governmental schemes operate takes some energy and some time to commit. But I think it is a really important point, particularly supporting people's expenses as they try and get to the practice placement and that sort of thing, I think is really key.
So Liv and I are both final year students. Within our 4 years of this MPharm degree, we have seen a lot of changes in the field, pharmacy first, things like that. So when you were a student, what were the major changes in pharmacy or healthcare, and how do they look like now?
If I can think that far back. So, what were the major challenges at that time? I mean, it's probably quite hard for you to believe, but we were still handwriting labels when I was at university. The idea of having digital technology to support the work we did was this bit of a pipe dream, really. And for my pre-reg year, I remember going to a hospital in East London, and which is the place I was able to go to in the end. They were running the whole pharmacy dispensing system off what we'd now call a laptop and a cassette tape that had the program in, and that ran the whole of the dispensing system for the hospital. And so you kind of reflect back and think that was a barrier. That was such a barrier at the time, and yet technology moves on very quickly and solves that. And the other thing I remember in particular was there'd been some trailblazers for clinical pharmacy, probably in the 70s even. People really trying to push the boundary. But when I came in, it was still a bit unknown, And so I went to Nottingham, and there were people who were really pushing clinical pharmacy forward as a area of practice, but not everybody could access it. It was limited places, and so a cohort of students will get it, but not the majority of students. And again, that's so different to probably your experience around placements and just this is kind of the business of pharmacy, whereas it was like a sort of a special bit. And I do remember in my pre-reg year going into the sort of ward environment, and there were consultants who were absolutely on board with pharmacy, but there were still people, medical consultants, who were still sort of saying, why is that person here? What is it they're doing?
Wow.
What's their contribution?
Yeah.
And so in that period of time, to have changed it to a situation where now the consultants are saying, where's my pharmacist? That consultant's got one, where's mine?
Yeah,
that
absolutely.
is just amazing.
Wow.
Transition really from in a sort of generation of practice.
At least there were some at the time that were sort of on board with it before it became more of a thing.
Yeah. I think there've always been people who understand why and the contribution. And I think what's happened is it's gone from maybe some enlightened people all the way through to everybody. And the kind of multi-professional working is much more of a thing now than it was in the era. So the good thing about that era was you could sort of almost say, well, I'd like to go and look after this group of patients on this ward. And there was almost a bit, well, off you go, So there was that kind of spirit of adventure. But it's now so much more organised and systematic, and people know what it is they have to do. And you have the kind of learning before you get exposed to that environment that makes you a better practitioner. And I think that's one of the huge transitions, So there was lots of scope maybe when I was doing it, but maybe we just didn't really have the same degree of orientation to, the heart was in the right place, but whether we had all the skills that we needed to do a good job at that time is probably a different question.
So my last question is, imagine you're going to a remote island where you will be the only pharmacist to look after a population of about 100 people. You're allowed to take 3 pharmaceutical items with you. What are they and why?
Whoa. So the temptation is to leap into this and say, what are the 3 things that I need on this island? But I think your mention of 100 people makes me think I should be thinking about the kind of general good as well as how I'm going to cope with the island. So depending on what discipline you ask, you probably get quite a different answer to that question. But so I'm going to come at it as a pharmacist and thinking about the stuff we know.
Yeah.
And it occurred to me, well, I would need an antibiotic, I think. Mm-hmm. It would need to have a kind of broad spectrum, well-established use in a population for a whole range of disorders. And maybe if it's a desert island, it needs to cover some sort of exotic stuff as well. So I'm going to go for doxycycline as my antibiotic of choice.
Mm-hmm.
And then I thought about pain. That's going to be a bit of an issue, isn't it? What analgesic could I pick that would have a spectrum of beneficial effects, maybe not just analgesia? So I'm going to go codeine on that because obviously it's a strong painkiller, but it also is a good antidiarrheal.
Yep.
And it has cough suppressant action as well. So those 3 things would make codeine my probably go-to for analgesic. And then the last one, I thought, well, I ought to try and be a bit interventive for people who are acutely ill. So I'm going to go for adrenaline, because I think it would cover a severe allergic reaction.
Yeah.
So if me or anybody else brushed up against an exotic plant and started to have an anaphylactic reaction, it would help. I was thinking if people were acutely ill with asthma, it would help. And then potentially, depending on what formulation we had, it would even be useful in cardiopulmonary resuscitation. So those are my three: codeine, adrenaline, and doxycycline.
That's a good three.
Thank you.
Yeah, I think that's really good, choosing ones that would all have like mechanisms of action that can apply to really different things. That's really interesting. That was all of our questions, but thank you so much for coming in and speaking to us.
It's brilliant. It's a pleasure. Really nice to meet you all.
Yeah, you too.
Thank you so much as
Thank
well.
you so much.
And that brings us to the end of another captivating episode of the Mug Hub podcast. We hope you enjoyed today's discussion and took away valuable insights that will fuel your passion for pharmacy.
Remember to subscribe to our podcast and stay tuned for future episodes where we continue to explore fascinating clinical topics, introduce you to incredible individuals, and enhance your skills to bridge the gap from bench to bedside.
If you've any questions, topic suggestions, or you'd like to get involved, we'd love to hear from you. Connect with us via our social media platforms or send us an email.
Until next time, keep learning, keep exploring, and keep engaging with your studies. Thank you for joining us at the Mug Hub podcast.